Paul, just wanted to let you know I just got off the call our team did with Vice President Pence and the White House Coronavirus Task Force. I'd like to just take a moment and thank the Vice President, all the members of the Coronavirus Task Force for all their work and assistance that they have given us over the last 10 months. I appreciate the Vice President's leadership in combating this virus. He's always answered the phone when Georgia called or needed him or needed the administration. And I know that my colleagues around the country, the governors of other states, feel the same way, and I'm deeply grateful for that. He did mention that the task force is working with the incoming Biden administration to ensure an orderly transition regarding their work to fight COVID-19. And I hope the incoming administration will take the same coordinated approach to the task force with the nation's governors as the Trump administration has over the last 10 months, and I'm sure that they will do that. Over the last week, the number of vaccines administered in Georgia has increased by 102,183, which is a 97% increase. Last week, we talked about a backlog in reporting, and these numbers certainly indicate we made significant progress in catching up. On another point of good news, if recent trend lines continue with Operation Warp Speed, the partnership with CVS and Walgreens, we expect they will be able to vaccinate all residents in Georgia nursing homes by the end of the month. If not, the state will step in to ensure that this mission is complete. These Georgians, as you know, are the most vulnerable to severe illness or death to this virus. So it will continue to be our top priority to ensure significant progress is made in vaccinating our nursing home residents. With all of that said, we certainly have a long way to go. As many of you have reported, many local health departments are being inundated with calls and website forms from Georgians hoping to schedule their vaccines. I'm asking that the media here today and those joining us remotely share these simple facts with the public. First, we have 1.3 million seniors and 536,000 healthcare workers in Georgia. Second, we are allocated 120,000 vaccines per week. 40,000 of those are immediately withheld from the state and sent to CVS and Walgreens to vaccinate our nursing home staff and residents through the federal program Operation Warp Speed. That leaves only 80,000 doses per week for vaccinating the expanded 1A criteria, or roughly 11,500 doses per day. And over the last week, we have been reporting that number or more every day in vaccines administered on the DPH dashboard. Simply, this means we are not only using up our daily allotment each day, but we are also catching providers up on reporting previous vaccine administrations, and this is certainly good news. In the month of the vaccine distribution, we were always going to have far more demand, even after we strictly limited eligibility, than we had supply. That is what both Dr. Toomey and I have said consistently since we began this lengthy process. Let me remind you, the state is not producing the vaccine or deciding how many vaccines are allocated. The number of vaccines administered is first and foremost dependent on the number of vaccines made available to us through the federal government and Operation Warp Speed. Yes, the phone lines will be busy. Yes, the websites will certainly crash. There's simply vastly more Georgians that want the vaccine than can get it today. This is no doubt frustrating. I would prefer that we have ample supply and we could vaccinate everyone immediately. Unfortunately, that is simply not possible. However, I am encouraged by the obvious demand for the vaccine because, as Dr. Toomey and every reputable public health official has said, this vaccine is safe, and it is highly effective. I will also say that all health districts and most providers are vaccinating on an appointment basis. Having spoken to Dr. Toomey and her team, it is our belief that this is the best approach to ensure accurate patient information is gathered, all safety protocols are followed, and that no vaccine is spoiled. Again, this will mean delays between receiving the vaccine and administering the dose. But these are corners that should not be cut with both the Pfizer and Moderna vaccine. I do not believe it is the right approach to have seniors out in January weather in long lines at a first-come, first-served vaccine drive. We have also unfortunately received reports of large providers holding vaccine in reserve. Let me be clear. If you are a provider who has signed a contract with the state and are receiving vaccines, we expect you to be administering those doses quickly and as safely as possible. If this issue continues, the state will take possession of those doses and ensure that vaccinations continue. If it takes me firing up my pickup truck and doing it myself, so be it. As of today, we have not been informed by Operation Warp Speed of when we will be shipped more vaccines than our current weekly allotment. Given today's news on planned release of second doses, I hope that we will get the specifics on exactly how much vaccine we will now receive and when we can expect it. We continue to hear concerns on additional populations eager to receive the vaccines. Educators, those with underlying conditions, disabilities, as well as their caregivers. Please know that we are working tirelessly to get our limited supply of the vaccine to those who need it and to whom it will do the most good. As soon as we have concrete guidance on vaccine supply and logistics infrastructure necessary for that expansion from Operation Warp Speed, we will act quickly and accordingly. I know that everyone is probably tired of me saying this, but I will continue to ask for people to be patient. Thursday of this week will mark 1 month since we received our first vaccine allocation, and there will continue to be roadblocks ahead as we roll this out. There will be mistakes made. There will be waiting and many obstacles we will have to work to overcome in the days ahead. But I can also commit to the people of this state that we are working around the clock to get vaccines in arms as quickly and as safely as we can. Thank you again for being here. Thank you for helping us to get this transparent information out to the people of our state. I'll turn it over to Dr. Toomey for her update, and then I'll come back and give you a brief update on Capitol Hill security with Colonel Wright and General Cardin. Dr. Toomey.
Thank you very much for being here today. I think there are two things in everyone's mind. One is the data. Where are the data? What do they mean? How accurate are they? It's very similar to the questions we were asked when this pandemic first started so many months ago. And the second is access. When can people get access? And let me just take each of those questions individually and cover in a little more detail the answers that the governor already addressed, because many of these answers are the same. As of 12 p.m. today, 227,199 doses are reported from our system, which is significantly less than what the CDC has on their website. And there's a number of reasons for that. Some may be the ability for our system to talk to the CDC system, and we are actually meeting with CDC now back at the office to find out where the glitch is in that transfer of data. But more importantly, we also know that many providers are not entering data into the vaccine reporting system, which is called GRITS, the Georgia Immunization Registry, that we have been using for many years. It's probably for about 20 years. And it's for this particular type of activity, which is a mass vaccine campaign versus, say, the vaccines for children or some smaller campaign. It's proven to be cumbersome and difficult for providers to enter all the data in. And even in some of these, our own public health sites, they're finding they're batching them and doing them later when in fact we're required by CDC to report these within 24 hours. And so even as we're moving on enhancements and some special programs to allow this to happen quicker and with more automation and less hands-on touch, we are also working to put in place an improved vaccine management system that will interface and allow us to report the data in a more timely way, and also have providers report and even order their vaccine more efficiently. And that, even as we work on that, though, there will be improvements in the system that I believe will result in improved data overall. The other thing is, I just want to mention again, even as the recommendations about whether the vaccine is coming in 2 doses or at once or a single dose, some providers are continuing to hold back doses. This is a 2-dose vaccine, whether you get Moderna or the Pfizer vaccine. And I think with the concern that at the federal level there may be some vaccine shortage, providers have wanted to hold on to the vaccine, which we've told them do not do. And if we continue to see them holding on to the vaccine and we see it in our system, we're going to take that vaccine and reallocate it, and they can reorder for that second dose, because we can't be waiting for the second dose at a time when we have such a demand for vaccine. I do want to say before I move on to access that I think the good news is that there's a tremendous demand for vaccine. I think the last time I was here, I was talking about how surprised I was at how few healthcare providers across the state, particularly outside of the metro area, actually wanted to be vaccinated. And this was true not only in hospitals and long-term care facilities, but even in our own public health departments. And so the good news is that we are now reaching individuals who recognize that this vaccine is safe, effective, and life-saving. And so we are very committed to ensuring that everyone who wants the vaccine can get it in as timely a way as we can, given the vaccine limitations. And we are limited until the production of the vaccine increases over the next months ahead. Given that, we have recognized also that just an individual vaccination in a public health clinic or even at a provider's office may not be sufficient to reach the number of people that we need to reach. This weekend, you may have been aware, here in Metro, we had 4 large-scale vaccination efforts in the metro area to try to catch up with all the backlog of healthcare workers here in Metro Atlanta that wanted to be vaccinated. And that was a very good turnout, with over almost 10,000 individuals vaccinated just this weekend. This past weekend alone. But we also recognize that these large-scale events will be important to reach the general public, and particularly now these older individuals who are trying very actively to reach in this phase 1A+. And so we are planning regional mass vaccination sites that what we anticipate will utilize a centralized system for setting appointments, which will make it much easier and not be that hard on the local health departments as you get massive numbers of phone calls. You know, the local health departments dealt with setting appointments for testing and the Spock testing statewide. And even when we had the highest demands, we didn't have this kind of demand. And so I think what we're recognizing is that our systems will need to be upgraded and improved to be able to address what I anticipate will be continued demand throughout the year as more vaccine is available and as we move into the next phases. I also am pleased to say that that regional retail pharmacies throughout the state will be added as providers. And there's a vaccine locator on our website. It doesn't have the ability to schedule vaccine, but it shows you where vaccines are in your neighborhood. And you'll see that additional providers will be added throughout the week as some of the retail pharmacies are added, and even more next week as more large pharmacies, both in metro and rural Georgia, are added. And so I don't think that that is the sum total of all of the current vaccination sites. Those will be increasing continually as we add additional providers with vaccine. We have a lot of providers, but just not sufficient vaccine to give them at this time, but we will be keeping track of that on that vaccine locator, the website, on our DPH website, and is a wonderful resource to be able to find vaccine for wherever you live in the state. As a reminder, our Phase 1A Plus not only includes the staff of hospitals, long-term care facilities, residents, the 65-plus individuals not in long-term care facilities and their caregivers if applicable, but also law enforcement, firefighters, first responders. So we are really reaching out to all of these. It's over 2 million people when you add all the groups together, and very aggressively hope to reach through all of our sites, including these mass sites, as we set them up to be able to reach everyone in a timely way as vaccine comes in. Again, please be patient. This will take some time. The vaccine is not as widely available as to the country as a whole as it will be months from now. But we will do everything we can to reach all those who want the vaccine as soon as we possibly can. I just finally wanted to add that I'm getting many, many questions about out-of-state residents, and I really have discouraged my fellow state health officials of sending their residents to us to be vaccinated, because we may have different criteria than they do. But we are trying to vaccinate our residents as well as those who work here but are from other states, as well as those who may come and winter here on Jekyll or St. Simon's or one of the other communities. And I think that I wanted to clarify that, because that is a question that we're getting a lot, and there has been some confusion that we might be open to out-of-state residents. We are not. And the final thing I wanted to leave you with is that we have reported that we have found the variant that is easily transmissible. This is the same one that was identified in the UK and has been identified in a number of other states, including Florida and California. We are actively now doing surveillance for the different variants, both that and the South African variant, through our public health lab, as well as through a partnership with the Centers for Disease Control and Prevention. As we identify additional cases, we will certainly let you know, but I think the major message I want to leave you with is what this tells us is it's two things. One is it's extremely important to continue, even as we're vaccinating, even as more and more people have access to the vaccine, it's very important to continue to wear a mask, social distance, follow the public health guidelines, wash your hands. These are the tools we have to prevent the spread of that variant that is more easily spread, as well as the COVID-19 virus that we've been dealing with all along. And we will continue to follow and that as we move forward, but at this point, all indications are that this variant is sensitive to the vaccine. So the good news is that our vaccinations will protect us from that variant as well. So I think that's the points I wanted to make, and I thank you for your opportunity to answer questions.
So just hold on one second. We're going to come right back to you, John. Sorry about that. Thank you, Dr. Toomey, for that. And I just want to make brief comments real quick before we open it up to questions for Dr. Toomey and myself and these gentlemen behind me. I want to assure everyone from legislators, staff, visitors, and the general public on down that the Department of Public Safety, the Georgia State Patrol, and the Georgia National Guard take the safety and security of the Capitol and the people here very seriously. Given the disgraceful, un-American acts we saw last week in Washington, these gentlemen and their teams are fully prepared to deal with anything and everything that may happen in the days and weeks ahead. As you know, we welcome peaceful protests, as we did last summer, and we want to ensure any peaceful demonstrator is able to exercise their First Amendment rights as much as they would like in a safe manner. But let me be clear, law-breaking like we saw last week will not be tolerated here, period. I'd like to thank everyone for being with us today. Dr. Toomey and I will be available, as well as Ryan Loke, on anything COVID-related, and General Cardin and Colonel Wright are standing by for any public safety questions that you guys may have. John?
Governor?
Hi, Governor Kemp. And
Y'all are going to have to speak
Haley
up
Mason
a
with
little
CBS
bit,
46
please.
News. I'm speaking about safety, Governor. Could you spell out for us what you all are doing to thwart any possible attacks on this Capitol and any plans that are happening here? And secondly, do you know where these groups are organizing these plans?
Well, just a couple of big picture things, and then I'll ask Colonel Wright to give you an update. We're obviously not going to talk about our security plans and tip off those that may have something in mind to what those are. I will tell you that we have a lot of experience dealing with this issue here in our state. We've certainly learned a lot, and we have a great team. We do know that the FBI has put out intelligence briefings. Colonel Wright, General Cardin have both been involved at their levels at the national level and with our partners here at the state level on the potential of those threats. I think our threat level that we are seeing and hearing in regards to the Georgia State Capitol seem to be very low at this point in time, but we are taking nothing for granted. I think you can see what happens when you do that looking back to last week. And with that, I'll turn it over to Colonel Wright to give you any more details on that, and then if General Cardin has something as well.
Thank you, Governor. As the Governor said, we are continuously monitoring intel and constantly updating our security plan on a continuous basis. We're well postured and well prepared to handle anything that may come in our direction that we may have to deal with. We just need to make certain that everyone understands that we certainly respect everyone's First Amendment right to peacefully protest, as the Governor said, but we will not tolerate unlawful or violent behavior in this state. We have been very clear on that all summer. We have been very clear on that. Anytime we have had to deal with protests or rioters around this city and around this state, and that will continue to be our stance as we move forward.
You know, from a Georgia National Guard perspective, we've had the honor to partner with the Georgia Department of Public Safety all the way back through the spring, and you are what your results say you are. We, through them, we're augmenting them, set the conditions for peaceful execution of people's First Amendment rights to free speech, and we're committed to supporting them in this upcoming security operation. We're just honored to serve with them. Thank you very much.
All right.
Thank you, Governor. Based on what I hear you saying, the vaccine rollout isn't going, and the feedback that we're getting as well, the rollout isn't going as well as we had planned. Or is there the thought of maybe having a sign-up process to maybe change it and have a wait list on there? And when will, as Dr. Toomey mentioned, we have some of those mass distribution sites up and running?
Well, we had sites up in the metro Atlanta area over the weekend that quite honestly were very successful, and I think our results over the last week, and certainly even since Friday when I last addressed you, we saw a 53% increase. So we are starting to move the needle. I think a lot of the things early on with the rollout and why I asked for patience to start with, the initial shipment of the vaccine, which, you know, we're not the ones saying where all this is shipped and how much, went to parts of the state when we had the criteria per CDC and Operation Warp Speed for healthcare workers and nursing homes and things of that nature, went to parts of the state where, quite honestly, if you take a lot of long-term care facilities, especially nursing homes, you have 60 to 70% of those working there that are not taking the vaccine, which created a supply in rural Georgia. In the metro area, as I've said repeatedly before, we had just the opposite happen. We had a huge demand from healthcare workers and others, and so we have to have that continuous supply to get that group vaccinated. And so when we expanded the criteria well over a week ago, and we said that it would be implemented yesterday, which was January the 11th, unfortunately, you know, the media said we're expanding the criteria to 65 and over, and people missed the part about only if the vaccine is available, and, you know, we're going to start doing this January 11th. Well, obviously people started, as soon as the press conference was over, they missed that part of my remarks. We've been very clear about that, and I know there's a lot of demand and people want to get the vaccine, but that's why we're asking the media to make sure and help us to report. You know, we have 1.3 million people that are over the age of 65. We have hundreds of thousands of healthcare workers. So we still have much more demand than we have supply. I can't control the supply. Dr. Toomey can't control the supply. You know, with today's announcement, hopefully we're going to get some more supply. But obviously with the new administration coming in on the 20th and going to work shortly thereafter, you know, those rules may change again. So we're going to keep dealing with what we know today. We've made great progress. There's also a lag in reporting, obviously, that I think we've made a lot of headway on, but also like CDC's website, when they ship the vaccine and process the order, that number goes on their website. Well, it may be several days before we receive it. So if you're doing the percentages of what they have shipped versus what we have administered, you know, that immediately makes our numbers go down because we haven't even gotten the vaccine to be able to start implementing receiving it. So there's a 3 to 4 day lag there that we can't really control. So I would tell people, if you look at us right now, you know, we're 30th, 33rd or so compared to the other states and territories. If you measure us compared to our neighbors here in the Southeast, we're doing very well in regards to that. But to Dr. Toomey and I, that is not good enough. We've got vaccines in some places that we need to get administered, which is why I mentioned some of these larger providers. If they have vaccines, they need to be given it. If they don't, we're going to come get it. And, you know, we are going to continue to keep you updated on our measured process forward. We knew there was going to be logistical challenges to this, which we've certainly seen, much like when we ramped up the testing. Even, you know, when we ramped up the testing and got overwhelmed, the whole country was, or at least parts of the country was, you saw where phone lines were very busy, our websites were very busy with the demand, and in most cases we were able to handle that. This demand is 5, 6, 10 times that demand. County public websites, public health department websites are not built for that kind of demand. This is a once-in-a-lifetime pandemic that, quite honestly, we are just having to deal with the situation on the ground today with the infrastructure, technology, and other things that we have. That's going to get better as we go through the process and we learn more and we're changing. I mean, if you see, you know, we expanded the criteria to age 65 well before CDC did. You know, today they're talking about other guidance, and we're certainly going to be looking at that. But we've tried to be forward-thinking to adjust with the situation that we have on the ground in this state. And Georgians have my commitment. We will continue to do that 24/7. Do you have anything you want to add to that, Dr. Toomey?
Thank you. And just that we are actually planning those large-scale sites around the state already. Today they're meeting while I'm over here to see where we can do that effectively so they cover the state. And several of our districts have already done large-scale vaccinations, including Augusta and Athens. So we recognize that this is the one way you can really reach a large number of people. One more thing I just wanted to say that I neglected to mention when I was talking about the variant, because I have been getting a lot of calls about it. The one tool we have for that is our contact tracers. And perhaps contact tracing is most important as we identify individuals with that variant, because we want to find every single individual who's been exposed and try to stop that spread, because it is so easily spread, probably 70% more easily than the common strain that we've been dealing with all along.
Yeah, Governor, today the federal government announced that vaccine allocation will be based on how quickly states can administer shots and the size of the elderly population. You and Dr. Toomey have talked about the disconnect with the state systems and the CDC, and then providers underreporting. How will you, moving forward, and hold those providers accountable and ensure that Georgia doesn't fall at the bottom of this list now that the federal government is saying they're shifting gears on how they'll allocate vaccines?
Well, first of all, I'd tell you that if you're talking about the same thing I think that you are, they said too that this would be implemented in 2 weeks. Obviously, in 2 weeks that could change. Quite honestly, I think that probably will with the new administration, but we'll stand by to watch that. But that's basically the same issue that we talked about with you all that were here on Friday, is we knew that we had given more vaccines than we were reporting. We have started stressing to the providers that it is imperative that you update the system, that you're giving us up-to-date information as quickly as you can so that we can reflect those numbers to the public and to those that are distributing the vaccine. Obviously, you've seen that since Friday, we've made a lot of headway with a 53% increase, and we're going to continue to work hard to get better every single day. So I think we'll be in good shape in regards to that, and we'll continue to see what guidance we get. I mean, look, what was told to us today on the call with the Vice President was a high level, this is what we're going to do. We haven't seen the details of that yet, so we've got a lot of debriefing to do when we get that information from the task force and Operation Warp Speed.
And just secondly, what do you say to seniors who view Georgia's rollout of the vaccine? I mean, I've been talking to seniors. They call it disorganized. They feel as if the government, it appears that you all don't care just with how.
Well, that's ridiculous, as you well know. We expanded the criteria to those over 65 before the CDC did. So to say that we don't care as a state is outrageous, quite honestly. And look, I feel their frustration. I mean, I've had those over 65. I talked to someone last night. One of the issues with a Fulton County Health Department website, that because of a technical error, IT at the county level, they were booking 3 times the appointments that they should have. It was not something anybody wanted to do. It was a technical error. It's one of those things that we've been warning people, that we were going to have bumps in the road. I think the health director there was very apologetic for that. They rushed vaccines to try to meet the demand. Unfortunately, some people left before that had happened. I called that guy back today, explained the situation once I found out what happened at the county. But clearly, as I said at the start of the press conference, with 1.3 million or whatever the number was of seniors that we have in this state, and getting a supply of 84,000, 85,000 doses a week for 159 counties, we are not going to be able to vaccinate those individuals overnight, which is why it was so imperative that Friday, when I said based on availability. If you're over 65, you're in that category, it is based on availability. And I said at that press conference, a lot of the metro counties don't have the availability, yet we do in other parts of the state. But we want to get vaccines in arms, so we felt like it was prudent for us to make sure that we expanded the criteria so that where there was the availability, we could get the shots in the arms. I'm hopeful that we'll get more doses from the feds and we'll be able to get more seniors vaccinated. Our goal is to make sure that we're getting every dose that we have in an arm. We made great progress since Friday, but we got to make more progress this week, and that's what I've been talking to Dr. Toomey about.
Governor, a question maybe for you, or perhaps Dr. Toomey would like to talk about this. For those providers who do administer the first dose, for those people who are able to get the first dose with demand high and supplies limited, how can they be assured that the second dose will be available 3 weeks later or whatever when it's time for them to get that dose?
Well, I mean, that's a great question. Maybe they, that's what we're all wondering, right? I mean, the task force today and the Vice President, Secretary Azar, said more doses are on the way. That's what President-elect Biden has also said. I take them at their word, but I also said in my remarks today, right now, we don't know, we haven't gotten notice from the federal government that we're going to get more than the current allocation we're getting, which is 120,000 a week. Off the top, 40,000 go to CVS and Walgreens for nursing homes and other long-term care facilities, which leaves the state with approximately 85,000 doses. And I hope that increases, but I don't know that it will, and until it does, I'm not real sure how we speak to that.
And one more question about people people who have underlying conditions, when their turn comes up, what preparations now should they be making to be able to prove to the provider that they really do have underlying conditions and they qualify?
Right.
To
well,
receive
obviously that guideline changed today. It was said on the call that a lot of that would be left up to the governors and to the state. So, we just got that on a 2 o'clock task force call that lasted till a little after 3. So Dr. Toomey's team and our office is already thinking about what that would look like and when we would be able to do that. That's not something that we obviously want to do right now, because just adding more people that are eligible when we don't have additional supply from the federal government is only going to frustrate more people. But that's something that we'll be working on. And we'll look to see what other states are doing as well, to see if there's some good best practices out there that others are doing.
The idea being that people now can get their documentation together.
I can't hear you, John.
The idea that people can now start getting their documentation together, so when they are eligible, they'll be able to bring the right paperwork to the right people. How will that work?
Well, that'll be something that we'll be working on. And look, we are committed. Dr. Toomey and our whole team is committed to continuing to be transparent with Georgians. I know that they are frustrated. I am too, in many ways, but also know that we've made great progress in the last week or so, and we want to continue to do that every week, and hopefully we'll get more availability soon where we can continue to expand the criteria. But I'd also remind you that, just about a month ago when we started rolling the vaccine out, we told Georgians this is going to take months and months and months to do this. So I would just remind them, I know people want the vaccine. I know especially right now why they want it after the post-holiday bump, and I can appreciate that. But we also know that until we get more availability, people need to wear their mask, socially distance, follow the guidelines, continue washing your hands, and just be smart about what you're doing and help those that are on the front lines in the healthcare fight.
Governor, there's some indication that public health districts just don't have enough people to get all the shots in the arm that they need to get into people's arms.
Could you say that one more time?
There's some indication that public health districts don't have enough personnel to administer as many shots as they need to administer. Are mass vaccination sites the state's strategy to solve that, and how are you going to staff those on an ongoing basis?
Well, I'll let Dr. Toomey speak to that. I can tell you that just from a big picture perspective, before she gets up here, our staff is looking at all available options. We will leave nothing on the table to get people vaccinated, whether it's the Guard, contract staffing, public-private partnerships, going strictly to the private sector. We have, thousands of providers that are signed up right now, but we just don't have doses of vaccines to ship to them. This is a very complicated process for giving these two vaccines that we have. It's not like the flu shot. You can't just open, Dr. Toomey just said this in our meeting earlier today, you can't just open one vial of the vaccine and give one person a shot that happens to walk up, because you may spoil the rest of the vial before the next person comes. So it's got to be an orderly process, has to be stored at the proper temperature. They've got to observe the patients for 15 minutes afterwards, which creates other logistical problems. And I'll let Dr. Toomey speak to the staffing part at Public Health.
I think you're absolutely right. We currently don't have enough staff, but we are really reaching out broadly to not only be able to bring on additional staff to help, but also bring in volunteers. ServeGeorgia.gov is a great resource for us, as have been the Medical Reserve Corps and other sites where people can volunteer. And I have gotten I must be getting calls every day from people who really want to help. They want to be part of this, but they may not be medically trained, but they can certainly help us with filling out the paperwork. They can help us with entering some of the data and helping us with that, keeping up with the flow of the data. So we are looking at all those options. But I think most importantly, this can't be public health doing this alone. This has to involve the private sector, physicians and hospitals, for this to be effective. This is too big, and this is not just a public health work. This is a public health program that must engage every single medical provider that we can enlist to help us, including the hospitals. And we're hoping that we can encourage as many hospitals as possible, not just to vaccinate their patients, but also to open up to the public as well as multiple providers. And there's some providers I've been talking to in places across the state, and one individual in particular in a Coney who is just has lines out of his office every day as he's beginning to vaccinate. I want to also comment, remember that this phase was only opened on Monday. And so that the fact that there's a few glitches after the first day is not surprising. And you see in other states that they're having similar kind of challenges, but we're better than other states. And this is going to work, and it's going to work well.
Now, I would just to follow up on that, remind you too, since Friday and over the last week, we have reported more vaccines every day than we have doses per day. So we have ample staff now. We also have large providers that have the bandwidth that have vaccines, and we've called on them to get those shots in arms. If not, we're going to come get those doses, and we'll do it. I think the challenge for us that we are already working on is when we get the expanded availability that hopefully is coming as production of the vaccine is ramped up, or if the second dose that's being held is shipped to the states to be a first dose to be followed up by new supply. How do we make sure that we continue to move the ball down the field and meet the needs of the supply that we have with the demand that we know we have in the state? And that's the things that we are working on right now. And if as Dr. Toomey says, we don't have the bandwidth to do that at Public Health, we're going to look at other options. We're going to make sure we're going to get it done.
Governor, on the data reporting issue that you've discussed, do you believe that you can get past it, get over that hump in the 2-week period that Secretary Azar has described as, needing to get your reporting up to speed and needing to get to the point where other states are for administration?
Well, I'll let Ryan Loke come up and speak to that real quick because he's been working on that issue. But I would remind people, we're 33rd in the country. A week ago or 10 days ago, we were in the bottom 3 because we were underreporting. So we're right where a lot of other states especially our neighbors, Alabama, South Carolina, North Carolina, Tennessee. I mean, we're kind of right in that same boat with them. So we got to make that happen. You know, we got to make sure that we're getting supply. But I'll also remind you that all that may change next Thursday. Ryan.
Thanks, Governor. Like I said on Friday when I stood up here, we were working very quickly with our public health partners to go through and audit the GRIT system to identify where inventory was versus what had been allocated and what had been reported as administered in our GRIT system. Between the time I stood up here on Friday and Friday night, we reported 35,000 new doses. Between Friday and today, we're going to report, I believe, close to 70 or 80,000 more doses. So we've gone through and are going through every single day now and auditing GRITs, looking at what's been administered, what's in the inventory, what's been allocated, to make sure that we actually have updated in our GRIT system and what's reported on our website, the most accurate information that we can. If you go and look at the CDC website right now, and I'm not going to throw the CDC under the bus, but they're showing that we've reported 140,000 doses administered. As of last night, we're up to 206,000. Today, it'll be 227,000. So there's something going on there, either on our side or on the CDC side, but we've got to make sure that we get that fixed in the next 2 weeks, depending on what the federal government outlines for us.
And one other vaccine question. In addition to the personnel issue that was asked about earlier, obviously there's an issue of money and where the money comes from to help you do all of this. What sources of funds are available, whether it's CARES Act or others, for you all to ramp up the vaccination program from where it is right now?
Well, it's my belief that we have the funds to ramp up. I appreciate the Trump administration, the Vice President, the task force, the members of Congress that have been working on all the different relief packages to help the states. You know, the incoming administration says there's going to be more. You know, Dr. Toomey can speak to any specifics on funding that public health's getting, but I believe we have plenty of bandwidth there. As you know, our state's finances are much better than a lot of other states, so we have bandwidth to do what we need to do. This is the most important thing in my mind that we have to get done. We will use every resource, human and financial, to make sure that that happens.
Governor, you talked about the concern associated with providers holding back on the vaccines. I made a phone call today to one of the providers listed on the Department of Public Health's website, located in Gwinnett County. They told me that they were not providing the vaccine to anyone, only to their patients. Is this a case of one of these sites listed on the state website as a vaccine location that's not providing to the public when they should be?
Well, obviously, I'm not sure what site you're talking about or any details with it. I'm glad to try to answer that question. If you'll let us know who that is, we'll find out and we'll get you an answer to that.
If they're listed on that state site, shouldn't they be providing the vaccine to anyone that meets the requirement above 65 and older?
That's my understanding, but I'll let Dr. Toomey or Ryan Loke speak to that.
And why are some of these providers holding back, in your opinion?
No, we called all the providers to ensure that they were indeed willing to take all comers, not just their own patients. And so if you can give me the name of the provider, we'll follow up on that.
Okay,
and
thank you.
I really appreciate that.
And why are they holding back? What is your understanding of that?
If they've been allocated doses, you know, some of these hospital systems have large numbers of patients. I think Emory has, 450,000. Wellstar probably has a similar. They would like to vaccinate their own patient population first before they open it up to others. And I understand that, but they shouldn't be on that website with the impression that they are opening it up to others. And again, the public health team is deployed to do this, including many of our other staff to help assist this. But this can't be done statewide to the level that will be required as we continue to open up the various categories without the engagement of all the private sector providers.
Thank you.
And let me just add, you know, I addressed that in my remarks. When we figure out who that facility is or site is, if they're holding vaccines and they're not giving them, we're going to come get it and give them to people that will get them out.
Are these providers, are they mostly hospitals? Are they pharmacies? I'm just curious which
Are
providers.
you talking about the facilities that
the ones that are holding
may
back?
be holding?
Right.
Yeah, I'll let Ryan Loach speak to that.
So it looks like it does appear to be hospitals that do have a large patient population. As Dr. Toomey said, we absolutely understand that, but we also want to make sure that they're working as quickly as they can to administer those vaccines to their patient population. If they need help with that, or if they need more resources, public health is ready to assist, the National Guard is ready to assist, but it's hospitals, it could be public health clinics. It's probably not pharmacies at this point, but one or the other.